Hey guys, and welcome to How to Gastro. So in today's video, we'll be discussing what is a hemoglobin or an HB blood test. So let's get started. So before we get into the specifics of the hemoglobin blood test itself, let's talk a little bit about the blood test procedure. So the blood test procedure is made out of three basic steps: step 1, step 2, and step 3. So a hemoglobin blood test is typically done through a simple blood draw. So here, a healthcare professional will use a needle to draw blood, usually from a vein in your arm. When the needle is inserted into the vein, the blood is collected into a purple top or EDTA blood tube. The collected blood is then sent to a laboratory where it is analyzed using automated machines and then resulted. So that's basically what you can expect to occur in the blood test procedure. So moving right along, let's talk specifically about what is a hemoglobin blood test. So hemoglobin, also known as HB or HGB, is an essential protein that is found in the red blood cells that is responsible for transporting oxygen from the lungs to the body's tissues and carrying carbon dioxide from the tissues back to the lungs to be exhaled. So it is a key component in maintaining the body's oxygen supply and supporting cellular function. So hemoglobin is made up of 4 protein subunits, which each contain a heme group. And the heme group contains an ion, which binds to the oxygen molecules. So a hemoglobin blood test measures the levels of hemoglobin in your blood. So this is what the basic structure of the hemoglobin protein looks like. And as we can see, it's made up of these 4 subunits. And each of these subunits actually contain an ion, which actually binds to the oxygen and carbon dioxide for gaseous exchange. The functions of hemoglobin. So as we mentioned in the previous slide, hemoglobin is essential for oxygen transport. So hemoglobin picks up oxygen in the lungs and carries it through the bloodstream to the tissues and the organs. There, it releases the oxygen for use in energy production. The second function of hemoglobin is carbon dioxide transport. So hemoglobin also helps transport carbon dioxide, which is a waste product of cellular metabolism, from the tissues back to the lungs for exhalation. So if we take a closer look at this picture on the right, we see that it's involved in the carrying of oxygen to the body cells and then the carrying of the carbon dioxide back to the lungs for exhalation. And the third function of hemoglobin is buffering. So hemoglobin also plays a role in regulating blood pH by binding to hydrogen ions, which helps to maintain the body's acid-base balance. So now let's talk a little bit about the normal levels of hemoglobin. So normal hemoglobin blood levels vary depending on age, sex, and overall health. But here are the typical reference ranges in healthy individuals. So in adult males, we have 13.8 to 17.2 grams per deciliter. In adult females, we have 12.1 to 15.1 grams per deciliter. And in children, the range can vary, but generally it's around 11 to 16 grams per deciliter, depending on the child's age. And in pregnant women, the normal ranges are from 11 to 14 grams per deciliter and are usually slightly lower due to the increased blood volume. So now that we know what the normal levels look like, let's speak a little bit about abnormal levels. So what causes low hemoglobin levels? So low hemoglobin levels can be caused by a variety of factors, each affecting the body's ability to produce enough healthy red blood cells or leading to their loss or destruction. So let's explore these causes a little further. So the first cause of low hemoglobin levels is nutritional deficiencies. So here we could have an iron deficiency. So iron is crucial for hemoglobin production, and a lack in iron due to poor diet or malabsorption, such as in diseases like celiac disease, or in cases of chronic blood loss, for example, from heavy menstrual periods or a GI bleed, such as in cases of a chronic bleeding ulcer, can lead to an iron deficiency anemia. This can also be seen in meat-free or vegan diets. Also under the category of nutritional deficiencies, we can have a vitamin B12 deficiency. So vitamin B12 is also essential for red blood cell production, and a deficiency can result from poor dietary intake, especially again in vegetarians and vegans, in pernicious anemia, or in malabsorption syndromes, which also can occur after certain gastrointestinal surgeries, for example. Also falling under the category of nutritional deficiencies, we can have a folate deficiency, which can cause a low hemoglobin level. So folate or vitamin B9 is also important for red blood cell production, and a folate deficiency may result from poor diet, alcoholism, or malabsorption syndromes again. So these are all the nutritional deficiencies, iron deficiencies, vitamin B12 deficiencies, and folate deficiencies that can cause low hemoglobin levels. So another cause for low hemoglobin levels are chronic diseases. The first one being chronic kidney disease. So the kidneys produce erythropoietin, which is a hormone that stimulates red blood cell production. In kidney disease, erythropoietin levels may be very low, leading to anemia and a low hemoglobin. We can also have chronic inflammatory diseases, such as conditions like rheumatoid arthritis, lupus, or inflammatory bowel disease, which can interfere with red blood cell production. And lastly, some cancers or their treatments, like chemotherapy and radiation therapy, can suppress bone marrow function, leading to low hemoglobin levels as well. So these three subcategories fall under chronic diseases and are also causes for low hemoglobin levels in the body. Coming in at number 3, we have blood loss. So acute blood loss from surgery, trauma, or significant injury can rapidly decrease the blood hemoglobin levels. We can then have chronic blood loss from conditions like peptic ulcers, which bleed out from time to time, hemorrhoids, which cause chronic bleeding, or chronic heavy menstrual bleeding, which all can gradually lead to anemia, will also cause low hemoglobin levels. At number 4, we have bone marrow disorders. So aplastic anemia is a condition where the bone marrow fails to produce enough red blood cells, which will also cause a low hemoglobin level. We then have leukemia and myelodysplastic syndromes, and these are cancers that affect the bone marrow function and can lead to low red blood cell production, leading to low hemoglobin levels. And then we can have bone marrow infiltration. So diseases such as lymphomas or metastatic cancers or myelofibrosis can infiltrate the bone marrow and disrupt red blood cell production, which in turn leads to low hemoglobin levels. The fifth cause of low hemoglobin levels is increased red blood cell destruction. So in cases like hemolytic anemia, which is a condition where red blood cells are destroyed faster than they can be produced, such as in autoimmune hemolytic anemia, sickle cell disease, or thalassemia, we will have low hemoglobin levels noted. We can also have inherited disorders like sickle cell disease, thalassemia, and other hemoglobinopathies, which can cause hemoglobin abnormalities, leading to anemia and low hemoglobin levels. Infections coming in at number 6. So chronic or severe infections like malaria, HIV, and TB can lead to anemia by affecting red blood cell production or increasing the destruction of red blood cells, which will also in turn cause a low hemoglobin level. Medications coming in at number 7. So certain drugs such as chemotherapy, certain antibiotics, or drugs used to treat autoimmune diseases can suppress the bone marrow function or also cause hemolysis, which both lead to low hemoglobin levels. Number 8 is pregnancy. So during pregnancy, we have something called a dilutional anemia, which means the plasma volume increases more than the red blood cell mass, which can dilute the hemoglobin and lead to physiologically lower levels. So that's why in the slide where I showed the normal levels of hemoglobin, pregnant women were seen to have a normal range of 11 to 14, while normal healthy adult females have a range from 12.1 to 15.1 grams per deciliter. And this is because of dilutional anemia. Coming in at number 9, we have genetic conditions such as thalassemia and sickle cell disease. So these are genetic disorders which involve abnormal hemoglobin production, which also leads to chronic anemia and low levels of hemoglobin. And then we have some other causes coming in at number 10, which includes alcoholism. So excessive alcohol intake can lead to poor nutrition, bone marrow suppression, and GI bleeding, which all contribute to low levels of hemoglobin in the body. We then have overhydration, which means excess fluid intake, which can dilute the blood, reducing hemoglobin concentrations on blood tests. So that may be a cause for low hemoglobin levels showing up on a blood test as well. So now that we've explored all the causes of low hemoglobin levels, let's talk a little bit about what are the causes of high hemoglobin levels. So high hemoglobin levels, known as polycythemia, can be caused by several factors, often related to increased red cell production or reduced plasma volume. So let's explore these causes a little further as well. So coming in at number 1, we have living at high altitudes. So at high altitudes, the air has lower oxygen levels, prompting the body to produce more red blood cells and hemoglobin to carry enough oxygen to the body's tissues. And this will therefore cause a high hemoglobin level on a blood test. We then have chronic lung diseases. So chronic obstructive pulmonary disease, or COPD, which includes conditions like emphysema or chronic bronchitis, can lead to low levels of oxygen, stimulating increased hemoglobin production. So because these guys often have dyspnea, which means a difficulty in breathing, their body actually compensates by increasing the amount of hemoglobin to aid in carrying enough oxygen to the body's tissues so that the patient's oxygen saturation stats are not dropping too much. So this is another cause for high hemoglobin levels. We can also have sleep apnea. So this is a condition that causes intermittent drops in blood oxygen levels during sleep, leading to higher hemoglobin levels. So this is another compensation mechanism by the body to try and prevent that intermittent drop in oxygen level. It actually stimulates increased hemoglobin production to compensate for this loss. At number 3, we have heart disease. So congenital heart disease can lead to lower oxygen levels in the blood, prompting the body to produce more hemoglobin. So these patients who suffer from congenital heart diseases often have a higher than normal hemoglobin level. We also have right to left heart shunts. So these abnormalities allow blood to bypass the lungs, reducing oxygenation, and also lead to higher hemoglobin levels in the blood. At number 4, we have a reduced plasma volume. So just as we discussed overhydration leading to low hemoglobin levels, dehydration concentrates the blood, making hemoglobins appear higher. So this is a relative increase rather than an actual increase in red blood cells. So this will need to be assessed properly in a clinical setting to ensure that it's an actual hemoglobin level that's increased, or whether it just appears to look that way because our patient is dehydrated. Coming in at number 5, we have Polycythemia Vera. So this is a bone marrow disorder where the bone marrow produces too many red blood cells, leading to elevated hemoglobin levels. And this can also increase the risk of blood clots occurring in the body. So it's quite a severe disease and also leads to high hemoglobin levels. At number 6, we have smoking. So smoking introduces carbon monoxide into the bloodstream, which binds to hemoglobin, reducing its oxygen carrying capacity. And therefore, the body will also compensate for this by producing more hemoglobin to carry enough oxygen to the body's tissues. At number 7, we have erythropoietin-producing tumors. So some tumors, especially in the kidneys, can produce excess amounts of erythropoietin, which is a hormone that stimulates red blood cell production, which can also lead to high hemoglobin levels showing up on a blood test. At number 8, we have the use of anabolic steroids or erythropoietin, and these fall under the category of performance-enhancing drugs. So athletes or bodybuilders who use anabolic steroids or erythropoietin can experience elevated hemoglobin levels due to increased red blood cell production, and this will show up as elevated hemoglobin levels on their blood tests. Number 9 is chronic hypoxia, which means low oxygen availability. So conditions like chronic bronchitis, pulmonary fibrosis, or sleep apnea can cause chronic low oxygen levels, leading to increased red blood cell production. At number 10, we have genetic factors. So familial polycythemia is an inherited disease that causes the body to produce more red blood cells, leading to higher hemoglobin levels. At number 11, we have medications such as testosterone replacement therapy, which can also stimulate red blood cell production, leading to higher hemoglobin levels. And at number 12, we have other causes, which include obesity, hypoventilation syndrome, which includes patients who carry a bit of excess weight, leading to breathing problems, reducing oxygen levels, and increasing hemoglobin production in the body. And patients who do excessive exercise. So intense endurance training can sometimes lead to higher hemoglobin levels as an adaptation to increased oxygen demand. So Olympic athletes or very skilled athletes usually also have high hemoglobin levels due to the intense endurance training their body undergoes, and this is due to their adaptation process to the increased demand in oxygen. So as we have just seen, the hemoglobin test is indeed a very important test because it provides critical information about a person's overall health, particularly in relation to the blood's ability to carry oxygen. And that brings us to the end of this video. Well, thank you guys so much for watching. I hope you found this video very interesting and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community. Take care and have a wonderful day further. Bye for now.